Some people have asked me, whether it be friends, some patients, most of my family knows this, but and asked me, hey man, why aren't you working? Why aren't you in your office? Why aren't you doing dentistry? And the main issue is that in our particular state of the Commonwealth of Pennsylvania, we have a code red at this point. There's areas, if you check out the governor's, or the office of the governor, his map as of last week, you can see in northern central Pennsylvania and northwestern Pennsylvania, there's some restrictions lifted, making it a code yellow. However, in the lower right or the southeastern portion, where we are in Philadelphia, Montgomery County, surrounding counties, we are still in a code red, which means a stay-at-home policy. And there's a lot of challenges that some people don't realize. A lot of people say they can't wait to get back to the way things were, and that is a nice wish. However, it's not going to happen. Things are going to change, hopefully for the better, and actually will be for the better. It's going to be much safer, and as you know, at our office, we adhere to the highest OSHA standards. We go above and beyond what is recommended, and we've done this for years. So, for instance, what I'm going to do tonight is just briefly go through the masks, things like N95, KN95, level 3 ASTM, things like that, splash shields, and things, and why it's a challenge for us as dentists to get back and reopen our offices, especially in an area such as this, where there's a high volume and potential of COVID infections based on what is going on and based on the models of the CDC, the American Dental Association, and so forth. So here is a graph. I just realized I hit New Jersey and not Pennsylvania, but it's the same. I've watched this, and our stay-at-home policy is working, and we're flattening the curve, as you can see here. And actually, New Jersey was a lot worse than Pennsylvania. So if we look at this image of a slide from a webinar that I attended 2 weeks ago, you can see already while we're not open, we are already generating a protocol and procedures to treat patients and to reopen and be safe. So in the first part of this, if you look at vitals, we're going to actually be doing questions, often called triaging, before the patient's even in our door. Even before they come in the office, we're going to make sure they haven't had COVID, they haven't been exposed to COVID, they've practiced lockdown, and so forth. And then when they come in, we'll ask those questions again. And before they're even seated, my staff is trained to take forehead temperatures using a forehead thermometer. Here, Alex is holding one up to my forehead, and then it's quite simple. In a matter of seconds, it tells you whether you have a temperature or not. But as you know, if it's someone in just an Advil, that can be hidden. So we are also going to be doing pulse oximeter readings. That is a great way of testing for lung capacity. If the person is in fact having difficulties, possibly due to COVID, in their lungs, this will show up with a simple test on the finger. And once the patient is cleared, they can be seated, and they will go to the room and rinse with hydrogen peroxide to minimize the viral load that may exist in their oral cavity. Main issue regarding procedures is the use of high-speed handpieces, the drill, or ultrasonic instruments, usually a Cavitron, which is used in hygiene, dental cleanings. And these are a big issue and big debate now regarding how to make them safe. In reality, almost all of dentistry, if it's involving a drill or an ultrasonic instrumentation, or an instrument, that's going to be a problem here. So At our office, as many of you know, or as many of my patients know, we do not use Cavitrons routinely. Cavitron is an ultrasonic instrument that really quickens a cleaning. A lot of people use it for a 20-minute cleaning. A lot of people go, hey, Lou, your hygienist takes almost an hour to clean my teeth. I used to get it done for 20, 25 minutes. Well, that's because they are using this. I think I have a picture here of a ultrasonic scaler, commonly called a Cavitron. And that instrument creates, water is squirting out, hits the tip of it, which is an ultrasonic instrument, vibrates it, and creates an aerosol cloud of respiratory droplets and water that really just doesn't fly with the new CDC recommendations and restrictions to prevent the spread of viruses. So we pride ourselves that our hygienists use hand scaling only, and Cavitrons, while we do have them, they are reserved for people who have periodontal issues and periodontal disease. So the patient is admitted and we're going to treat them. And now we're going to talk about PPE, personal protection equipment. So first we're going to look at the ideal mask. The ideal mask, as many of you heard in the news, is the N95, and there is a Chinese version of that called the KN95. These masks, here's an example of a N95. These masks filter out 95% of the particles that are surrounding the individual who's wearing one. And in order for this mask to properly seal and protect the individual who's wearing it, it needs two straps. One at the top will go around the top of the head, and the bottom one will go around the back of the head. And I bring this up because many of you probably saw just recently in the news, made it to the New York Times, that there is a now FDA ban on many of these products because up to 67% of these masks have been found to be counterfeit, in that they were only filtering out anywhere as low as 24 to 35% of the particles, not 95%. And they are, in fact, not what they appear to be or what they boast to be. And you can tell a counterfeit one by the fact that many of these masks are ear-looped masks. That is, they go around the ears, not around the back of the head. And I don't know about you guys, but I get on my Instagram, Facebook, many offers of masks. Hey, get these masks. They're available now. Buy two, and they'll save you a little money. This was one of them I took a screenshot of. This is a counterfeit N95. It was offered just the other day on my Facebook page. And you can see the nicely clear stamped N95, but there's no way that it can seal 95% of the particles around this person because it is in fact ear looped and not head strapped. Just to discuss the other things I'm getting from my staff. Again, none of this is set in stone, but when I reopen, you will see me and my staff in fully disposable gowns over our clothing. Those gowns will be cuffed sleeves that will be sealed up to the hands, which will be gloved. Over the mask, we will have goggles or face shields. I actually prefer face shields because they protect the full face. And in addition, over top of our heads, we'll have coverings. On our shoes, we'll have booties, disposable, of course. And in addition, we can, for consultations, have an ear loop mask called the Level 3 surgical mask, or as it says it in this image from the webinar, a grade 3 surgical mask. And that, coupled with a full face shield, is adequate to protect the clinicians who work in a dental office. Now, the full face shield I've always used, actually, in my practice. I'm fortunate enough to have a supply of those. But supplies are very hard to come by for a lot of this stuff. And that has been the main challenge for us, especially in Pennsylvania, to open and reopen. So finally, the last key dilemma is how dentists, how clinicians, doctors, lawyers, probably anyone in an office setting, but especially dentists, if you're going to stir up the virus, how do you get the aerosol or the virus in the air out of the room. So that will be a topic for my next video. I think I've made this video go on long enough. And thank you for tuning in, and stay tuned for my next quarantine dentist video. Good evening. A little trivia at the end of this video. Question, does anyone know who I'm showing here in this ancient Egyptian artifact?